Good morning, good afternoon, good evening from wherever you're watching from. Thank you for stopping over to watch this video. In today's video, we'll explore the roles of public health officers during disease outbreaks. Public health officers play a crucial role during an outbreak as they are responsible for managing and coordinating public health responses to control and mitigate the spread of diseases. They not only help prevent disease, but also prevent the spread of these diseases when they occur. Here's a summary of their key responsibilities during an outbreak. 1. Surveillance and monitoring. Data collection. Public health officers collect data from various sources, including hospitals, laboratories, and community reports, to track the number of cases, the geographic spread, and the demographics of affected populations. This data helps in understanding how the outbreak is progressing and where interventions are needed. Epidemiological analysis. They conduct studies to determine the source of the outbreak, for example, contaminated food, water, or person-to-person transmission, and how the disease is spreading. They use this information to identify patterns, such as the rate of new infections, and to forecast future trends, which is crucial for planning the response. 2. Public communication, risk communication. During an outbreak, misinformation can spread quickly, leading to panic or dangerous behaviors. Public health officers are responsible for providing the public with accurate, timely information. They might hold press conferences, issue public health advisories, and use social media to communicate the latest updates and guidelines. Health education. They educate the public on how to protect themselves, such as practicing good hygiene, understanding symptoms, and knowing when and where to seek medical care. Effective communication helps ensure that people understand the risks and the importance of following public health advice. Implementation of control measures is crucial in managing disease outbreaks. To control the spread of contagious diseases, public health officers may recommend or enforce quarantine, which means separating and restricting the movement of people exposed to the disease, or isolation, which involves separating people who are sick from those who are healthy. These measures are, critical in slowing the spread of the disease. If a vaccine is available, public health officers organize vaccination campaigns, ensuring that high-risk populations, such as healthcare workers or the elderly, are prioritized. They also monitor the coverage and effectiveness of the vaccination program. Additionally, they develop and promote guidelines for hygiene practices, like hand washing and social distancing measures, such as avoiding large gatherings to reduce transmission. Coordination with other agencies is fundamental in outbreak management. Outbreak management requires a coordinated effort across multiple sectors, including healthcare, emergency services, education, and transportation. Public health officers work with these agencies to ensure a unified and efficient response. This might include setting up emergency response centers, coordinating the distribution of supplies, and aligning public health messaging. They help prioritize and allocate resources such as personal protective equipment, medical supplies, and personnel to areas that need them most, ensuring that healthcare facilities and other critical services can continue to operate effectively. Investigation and research are key components in handling an outbreak. Public health officers lead investigations to identify the cause of the outbreak. For instance, if a foodborne illness is suspected, they might trace the source of the contamination back through the food supply chain. These investigations are essential for stopping the source of the infection and preventing future outbreaks. During an outbreak, new information about the disease often emerges. Public health officers collaborate with researchers to study the disease, evaluate the effectiveness of control measures, and contribute to the development of treatments or vaccines. This research can provide critical insights that shape the public health response. Public health policy and planning. Public health officers play a key role in shaping policies that govern the outbreak response. This might include policies on travel restrictions, the distribution of vaccines, or guidelines for businesses and schools. They also advocate for policies that protect vulnerable populations. After an outbreak, public health officers review the response to identify what worked well and what could be improved. They use these insights to update emergency preparedness plans. ensuring that their community is better prepared for future public health emergencies. Training and support. Public health officers train healthcare workers on the latest protocols for infection control, patient management, and the use of PPE. This training is crucial for protecting healthcare workers and ensuring they can provide safe and effective care. They engage with community leaders and organizations to ensure that public health measures are culturally appropriate and widely accepted. This might include working with religious leaders, schools, or local businesses to promote health and safety practices. Reporting and documentation. Public health officers are responsible for keeping local, national, and sometimes international health authorities informed about the status of the outbreak. This includes providing regular updates on case numbers, mortality rates, and the effectiveness of control measures. They meticulously document the outbreak response, including the actions taken and their outcomes. This documentation is essential for learning from the outbreak and improving future public health responses. Community support and mental health. Public health officers work to ensure that communities affected by the outbreak have access to essential services, including mental health support. The stress and anxiety associated with an outbreak can have significant mental health impacts, so they often coordinate with mental health professionals to provide support. They focus on protecting and supporting vulnerable populations, such as the elderly, individuals with pre-existing health conditions, or those in low-income communities who may be disproportionately affected by the outbreak. Evaluation and feedback. After the outbreak is under control, public health officers evaluate the effectiveness of the response, identifying strengths and areas for improvement. This feedback is crucial for refining public health strategies and preparedness for future events. In summary, public health officers are at the forefront of managing outbreaks, employing a combination of surveillance, communication, coordination, and direct intervention to protect public health. Their work involves not only managing the immediate crisis, but also planning and preparing for future public health challenges. Like and share this video with your friends and colleagues. Subscribe to our channel for similar informative and educational videos. Thank you for watching.